Did you know when you prescribe My Day, you're fitting contact lenses that are made for more performance, more success, and with more parameters? See what more looks like at coopervision.com/myday. For safety information, visit coopervision.com/safety.
Hi, I'm Dr. Jacob Lang, and welcome back to another special episode of the Mod Pod. This is the first installment of Season 2, the Empower series for 2026. Again, the goal of this series is to help advance optometric knowledge and to elevate our practices and our patient care. Today's episode will focus on contact lens success in the modern era, joined by two amazing colleagues and friends, Dr. Jaclyn Garlich and Dr. Melissa Barnett. So thank you both for spending some time with me, joining me for this conversation. I look forward to chatting with you. Jackie, why don't you introduce yourself and let the audience get to know you, although they probably already do.
Sure. Sure. I'm Jaclyn Garlich. I'm happy to be on this podcast with you two amazing people talking about contact lenses, something that I do a lot in my private practice. I have a private practice in Boston that is a primary care practice and also has an ocular surface disease specialty practice within that. So, yeah, looking forward to the discussion tonight.
And to the woman that literally wrote the book on contact lenses, Dr. Melissa Barnett.
Well, thank you, Jake, and thank you, Jackie. It's such a pleasure to be here with both of you to discuss one of my favorite topics, contact lenses. So I'm Dr. Melissa Barnett. I practice here in Northern California in Davis. I am also a certified life coach, and that comes up when we talk about contact lenses and how we talk to our patients. So it's great to be here and looking forward to this conversation.
Love it. Thank you both. Let's start with daily contact lenses. So new versus existing patients and how we incorporate daily contact lenses in your practice. So Jackie, you see a lot of like the more routine patients. When do you see daily disposable contact lenses fitting into your contact lens care and your contact lens practice?
Nearly every patient. To be honest with you, I fit my practice is very heavy daily contact lens wearers, and I think that's probably a component of two different things. One, I do see a lot of dry eye patients, so they tend to be more successful in a daily contact lens in general. And then two, a daily contact lens wearer is the best advocate to wear daily contact lenses. Like oftentimes a patient is coming in because their friend, their sibling, their partner wears dailies and they love them so much. So they end up asking for them sometimes without me even prompting it. So I certainly fit a lot of dailies, and for me that is my first go-to reach unless the parameters are outside the scope of a daily contact lens that what a daily can fit. But I love a daily. It's, in my opinion, the healthiest option for a contact lens.
So Jackie's patients are coming in begging for daily disposable lenses. I think, that's probably some of, your practice, but probably your mentality too, right? Like this is what we do. And that's is that your culture?
Well, I mean, patients will ask, like, sometimes patients just want to know what's new and what lens is the best lens. And I say, well, I personally choose a daily contact lens because it's the healthiest option. It's the lowest risk of an infection. And it's true. I mean, if I'm seeing a contact lens wearer back with an ulcer, it's almost always a 2 week or a month, it's a reusable contact lens. It's really rare that it's a daily contact lens. So I just explain that to the patient. I mean, people can be successful in any contact lens, but I tell them why I like to reach for a daily contact lens, and a lot of patients get on board with that.
I agree with Jackie. I always recommend a daily replacement lens. It's a clean, healthy lens that can be replaced every day. And I like to stress the health benefits to reduce infection, but I also tell my patients that it's really convenient for them. So it is the most convenient option. So to answer your question, Jake, I have some patients coming in asking for a daily. I have some who I recommend, and that's what we all need to do. We need to recommend a certain contact lens to our patients, just like we would prescribe a certain medication just like we would go over different spectacle lens options and recommend the specific one. We actually need to recommend contacts. So the way that I phrase this to my patients is if I could choose a lens for you, I would choose a daily replacement lens. And I say it just like that. And they're like, "Ooh, I want that." And then they say, "Why?" And I say, "Well, it's a clean, healthy lens. Also, it's super convenient."
I love it. Yeah, I choose you, right? What about bad candidates, Dr. Barnett? Like, is there anyone where you're like, you know what, I don't think a daily's your best option, or when do you see that occurring?
Well, I don't really see anyone unless the parameters don't allow. So if there's, say, astigmatism outside of the parameters, fortunately now we have soft toric multifocal lens options, but perhaps the parameters don't allow. I will say here in California, it's oftentimes a patient will come to me and say, "Oh, it's too much of a waste." And then we talk about recycling of contact lenses, how we can recycle them, and the number 5 recycling, how actually an annual supply of daily replacement lenses is less plastic than just a single multi-purpose contact lens solution or hydrogen peroxide lens solution. So I find oftentimes in the patient's mindset, they're thinking, "Oh, I can't do a daily lens or I don't want to because of the perceived waste or cost." And then I talk about recycling and also the cost of solutions that they don't need with a daily lens because they can replace it each day.
That was a great point, Melissa. What are you seeing with solutions, or what do you talked about with regards to solutions when you're talking about daily disposables, or why I want you to switch to a daily disposables? Do you talk about solutions a lot?
Sure. I oftentimes talk about multi-purpose solutions that are generic, and it is whatever solution is in the bottle. So the solution could be different from time to time versus a known solution in a reusable lens, of course. And I am a huge fan of hydrogen peroxide based solutions for reusable patients, for those who wear reusable contact lenses. But for daily replacement wearers, I talk about the cost of solution that they don't need anymore because they can eliminate that completely.
Yeah, totally agree. They don't, the lovely thing about a daily is, especially if someone's having some discomfort in a, reusable contact lens, the solution that they're using is a variable into why that person might be uncomfortable in the first place. And so just eliminating like that, that need for solution can sometimes be very helpful in addition to just going to a daily. So yeah, totally agree. And then for the reusable wears, I am also a big fan of hydrogen peroxide. I don't have to wonder how good someone is cleaning the lens, because the reality is many patients are not cleaning them well. So I recommend a hydrogen peroxide also.
And great questions to ask patients about comfort is the end of day comfort. How does the contact lens feel at the end of the day? And then also the end of the replacement cycle. For example, if it's a 1 week lens or a 2 week lens or a 1 month lens, how does the lens feel? I have many patients who say, "Oh, I came in wearing a 1 month replacement lens, but I replace it every 2 to 3 weeks because it gets really uncomfortable." Those are great candidates for daily replacement lenses.
I had a patient the other day who was like, "I'm doing fine." He was in a reusable lens. He said, "Oh, I don't have any issues. I've been in these contacts forever." I hear that like they've been working okay. And then he's like, "Well, but do you recommend a different lens?" And I was like, "Oh, well, here's my open door to talk about daily lenses." And then he was like, "I do actually really like how my lens feels when I put in a fresh lens." And I go, "Yeah, imagine that every day, doing that every day." And but he also came in like, "I'm happy with my lenses. I don't have any problems." And then once it was like more questions were sort of deeper, then he was like, "Oh yeah, I do really like how they feel when they're fresh." I go, "Yeah, I know."
I think that's great with the new technologies we have. So there are so many great new contact lens technologies. I had a patient last week who I fit in a new technology where she's like, "Wow, this is amazing. It feels like nothing. It feels incredible. I don't even feel it." And so it's really important that we offer these new technologies to our patients because the contact lens technologies we have are so much better than they've ever been.
I think that's a great point. Jackie's point, like some patients come in and they want, right? They want the newest, the best. They want to know what's cutting edge. They've got the new iPhone and, the new AirPods, and they want what's new in their contacts. But a lot of patients are just okay, right? Like happy is probably a relative term. And they're like, yeah, these are fine. I don't want to, I don't want to change. I'm not going to complain. The non-complainers maybe. And having that window or that opportunity to be like, hey, this is what I would recommend, or something that sometimes people give you a window for, sometimes they don't, and you have to try and make a window, right? Bring it up in some way, shape, or form. I know a lot of my dry eye patients, I'll find a way to say like, oh, these are something different we could do, or this would be our next steps. So if this stops working or they stop making your contact, this would be my next steps, and why.
One thing I was going to comment on is I sometimes think patients, like you said, Jake, are used to what they're used to. They're doing fine in it, and they know the price of their own contact lens. And there is this mindset that it's dailies are cost prohibitive to a lot of people. And I tell that to patients too. I say, there's so many good dailies. Historically, I think they used to be a little more cost prohibitive to some patients, but they have, huge rebates on year supplies, which make them a lot more affordable to patients too. So I think the cost, many years ago used to be a big deterrent to going into a daily contact lens. And I don't think that's the case anymore.
I definitely agree with that. And also the costs of other modalities of contact lenses too, with the rebates included. It's very cost effective. I always like a good challenge. So I like to ask my patients, what could be better with your contact lenses? Is it vision? Is it comfort? Is it end of day comfort? Is it end of wear comfort, replacement comfort? And then that opens the door. And some people say, "Ooh, I don't want to answer that. I don't want to go there." And I love it because because contact lenses, we have great technologies, right? We have all types of technologies. We have soft lenses, we have corneal GPs, hybrid sclerals. So I like to start simple and then get super complicated. And I like to open that door and say, what could be better with your contact lenses?
Yeah. Dr. Pandora here opening these boxes and see what you can find. I love it. So I always, mention the solutions too, right? I've mentioned that like you don't have to buy this anymore. So that's always an added benefit of the dailies is you don't not only do you not have to use it and maybe it doesn't irritate you, but you don't have to buy the solutions anymore.
Melissa, I might steal that from you. I typically I'm very like no pressure. I don't want patients to feel pressured to going into a daily contact lens. So I usually will say like, or how are your contacts? Are they comfortable? Can you wear them all day without any discomfort? Like you have any issues? And the patient's like, no, all good, all good. I'm like, okay, just so you know, there are always new contacts coming out. So if ever I have a patient who's not in love with their contacts, you let me know because there's always good options out there. I kind of like it's open if you would, and then it feels very no pressure to the patient. Like I'm not trying to force any new lens on you. I'm just telling you we got good options out there.
So if you guys had a patient you wanted to switch, whether it's you're looking at their eye and it's irritated, or there's some staining, or something where you're just like, I can do better. Give me the window. How do you bring that up with a patient? Like, let me switch you into dailies.
I like to offer it. Let's just try it in the office. You don't have to go home with it. You don't even have to try it after we try it here. They say, "Oh, okay, I'll try it in the office. That's okay." And then they try it and then they say, "This is the most comfortable contact lens I've ever worn. Can I go home with it? And can I have yes, yes, yes." That's a great advantage with daily replacement lenses is that we can try it on right in the office. The patient has the wonderful experience and it's an easy switch.
Yeah, I agree. I think if you've got trials in the office, like you have some brands that work well, and you have something you can have them put on immediately, I think that does give a wow factor. And oftentimes, you are trying to fix the patient's pain point, which can be duration of contact lens wear. Everyone's days are longer, they're staring at screens a lot more. So if they have some discomfort, a lot of people they want something more comfortable, and you can offer that and just grab some trials and have them put them on. Very effective.
And the great thing too is now with multifocal daily replacement contact lenses, I do the same thing where a patient's like, I don't know. I don't know if I want to try it. I said, well, would you like to try it here in the office and try it on, see what you think? And then that's a really good way to transition to a multifocal contact lens fitting.
Mm-hmm. Yep, you led me right into this. That's awesome.
Did you know when you prescribe My Day, you're fitting contact lenses that are made for more performance, more success, and with more parameters? See what more looks like at coopervision.com/myday. For safety information, visit coopervision.com/safety.
I'm going to set you guys up here. Like this patient walks in, contact lens wearer, been doing good, but they have, you notice this year, they have, a pair of cheaters on their head, a pair of cheaters in their pocket, another pair in their hand, and you can see that this presbyopia thing has set in. How do you explain like the presbyopia conversion thing in contact lenses? And how do you set them up for the discussion surrounding multifocality and multifocality in their contact lenses specifically?
So oftentimes, all those glasses, they forgot them all because they were in the car, they were at work, or they were at home. But yes, presbyopia is real, highly prevalent. Everyone who lives long enough does develop presbyopia. So I like to talk to my patients that it's a normal change that occurs over time. I don't like to use the word old or age or anything like that. And then I talk about specific circumstances and ask them questions about their own lives. Are they having trouble looking at the computer, the phone? And this is the only time I like phones in the office, actually. I have them pull out their phone and look at a normal size text message to actually look and see. Then I talk about the contact lens option. So I love a daily replacement multifocal contact lens. We have great contact lens options in many different parameters. And I explain the neuroadaptation process that it takes about 2 weeks. Oftentimes it's much less than 2 weeks, but I tell my patients 2 weeks. And then once I fit them with contact lenses according to the fitting guide, when I lecture and teach students, I make them chant, follow the fitting guide. All of you don't have to do that, but they chant it, and they're so good at fitting multifocal contact lenses. Students are far better than doctors who've been practicing for many years.
Oh, bad habits, huh?
Yes, following the fitting guide, and especially that advanced or troubleshooting fitting guide, is going to give you tremendous success. And then I have them look binocularly at distance, pull out that reading card, look up close. And the question I ask that is very helpful is up close is, do you see double overlapping? And that's how I say it, double overlapping. They're like, oh, yeah, yeah, I see that. Great, that's normal. That is what to expect because of the neuroadaptation. It's going to take your brain about 2 weeks to get used to it. And then I have them look around, they can go outside, they can look at different things and explain the process. For anyone who has not worn contact lenses, of course, explaining how to apply and remove contact lenses. And this is a great opportunity. We can fit presbyopes in contact lenses for the first time. And that is so fun and they love it. It's amazing how much that's grown my practice fitting soft daily replacement lenses. It's just incredible. They refer their friends, their family, and everyone. And then seeing your patient back and checking everything using loose lenses, of course, and plus a quarter diopter steps. And it's always so fun to wow our patients.
Yeah, the presbyopes know, right? Like when you walk in and you're not using your readers or your glasses and you're reading a menu or reading your text, like we notice, like, what are you doing, right? Like, how are you doing that without help? Like, we know that you shouldn't be able to do that, especially when people switch, right? Like last week when we went to lunch, you were wearing readers and you're not wearing them this time, and I am. So what's going on here?
I usually, when I see a patient who's in their early 40s or in their mid 40s, and let's say they have readers, even if I don't see them, I'll ask, how's it going with your contacts? Are you needing readers on top of your contacts? Like if they're just in distance only. And if they, say, oh yeah, I'm using readers, I say, well, does that bother you? Because you do have other options. So I think a lot of times patients don't even know that there's other options. Oh, there's a multifocal, or, we've got, I don't generally fit this anymore, but monovision is an option. We've got presbyopia drops. We've got lots of solutions to help this patient. And I think part of it is just giving them the education and seeing what would fit best in their life. And, like Melissa, you said, there are many good multifocal options now for patients that provide really good reading. And the important thing is to set the stage on what to expect for a multifocal. We're doing this with other things now, but it's not necessarily 20/20 vision, it's functional vision. How are we doing up close? And sometimes I'll give that reading card and they'll say, well, I can't read this small print. And I say, well, do you need to? Like, this is really small. Do you actually need that in your everyday life? And if they say, oh, no, I probably am here. And I'm like, okay, well, how do we feel about here? What is your day? Like, tell me what needs we need to meet. And then we've got solutions for those.
You mentioned monovision a little bit. Why do you feel like you're not fitting monovision as much or fitting it like you used to be?
I just like to keep a patient binocular. I want binocular work for both distance and for reading. And I think it helps with, fatigue and eye strain. I certainly will sometimes fit in a monovision patient. But yeah, I tend to reach for the multifocal more frequently just because they're really good and they can work really well and keep a patient binocular.
And in every study, multifocal contact lenses win. So every single modality, whether it's a soft lens or a rigid lens. But much of our lives these days are on devices, and it's the mid range vision. Also, think about the shopping vision and seeing at the mid range in the car. There's so many different things. So, multifocal lenses are a great option. Now, sometimes we can do a modified multifocal. We might do, say, a soft toric in one eye, a multifocal in another eye. But the wonderful thing about multifocal scleral lenses is that we can correct irregular astigmatism as well. And that's really fun to impress the patient.
Yeah, for sure. That patient that we're switching from monovision or has been doing monovision in the past, and I think your point about like our lives are much different. It's not just newspaper anymore. It's far away in newspaper. Like felt like it was always the two things people did, or a book. Now it's to your point, Melissa, it's the phone, it's the computer. How do you set them up for success? Like the neuroadaptation talk, does that change when you're switching from that? Or are there any other tips for the listeners?
Sure, it depends the level of presbyopia. So whether it's mild, moderate, or advanced presbyopia, I would recommend to everyone to start fitting multifocal contact lenses sooner rather than later because it's much easier to adapt to a multifocal lens with mild presbyopia versus advanced. So for monovision, when we have someone who has a mild amount of asymmetry, it's easier to adapt. But when we have an advanced presbyope in full blown monovision, it can be really, really tough. Now, that's not to say we can't be successful, but I always tell my patients it's going to take longer to adapt to that because it's very, very different. I have been surprised for some patients how quickly they adapt, but I like to tell them that it will take some time. So, educating our patients on that. And then also, now we have pharmaceutical options for presbyopia too. So, it's super fun when we get to use these options with contact lenses. So, even near center multifocal lenses, they're showing benefits with pharmaceutical options and multifocals. Or I've had a lot of success fitting distance for contact lenses and using pharmaceutical options for up close.
That's great. That's a great point that we have more options besides just multifocality in our contacts that we can, hopefully help with some meiosis as well. Or at least that's an option for many patients. Let's talk about the future. So let's fast forward, 10 years. What are you excited about that's going to happen, or at least in your opinion is going to happen with regards to contact lenses? The future is always, exciting to think about new things. Anything you're looking forward to with regards to contact lenses and the future? Jackie, any thoughts?
I don't know if this is the future. I'm very hopeful that it will be, but that we will see more contact lenses delivering drugs. So I think drug delivery in a contact lens it is such an opportunity, and that will move from being just a vision correction as to an actual treatment for something. And so, I mean, we have seen this it's not available in the United States, but the AccuView TheraVision that has ketotifen in that. That's the 1-day moist lens that it can help with an allergy. That sounds incredible. We don't have that here in the U.S., so our Canadian friends have that, but I'm hopeful for more drug delivery options in contact lenses.
What class would you say would you go for first if you could do one thing?
I mean, if we're making wish lists here, and if
Yeah,
I
we
could just
are. We're making
anything.
dreams happen.
Okay, I would love to make the dream of a dry eye patient that really wants to get back into contact lenses. This is the common thing that you hear: a patient who has dryness, they're unable to wear contacts, and they used to wear them all the time. What can we put an immunomodulator in a contact lens? I don't know. I'm making this up, but like, what can be our drug to help our dry eye patients who want to wear contacts, but also have a therapeutic benefit?
I love it. I love it. Melissa, what do you think?
Well, I completely agree with Jackie. And just to add on to your dream, Jackie, I'm going to add two more things to that because I think dry eye and contact lens wear is great. Let's also correct for presbyopia and have an eye whitening agent in there too.
All right. I love it. So we're going to make our eyes whiter by putting our contacts
Mhm.
in.
Yeah.
That's an
But
awesome one.
drug delivery options, there's so many great studies looking at glaucoma. There's so many opportunities to correct myopia, retinal correction as well. But as far as the future of contacts, it is fantastic when we're talking about specialty lenses, having telescopes and different devices within contact lenses. We can collect the tears and measure them, and for all sorts of conditions, not just ocular but systemic conditions. We also have the great opportunity now with scleral lenses to use them as drug delivery devices, putting medications in the bowl of the lens. So I'm also hoping for new technologies, new materials, improved vision, improved comfort, and the future is bright for
Yeah.
contact lenses.
For sure. I love it. This has been great. So, I kind of got some thoughts about this. We went with the dailies and kind of seeing is believing. There's this instant gratification thing. When we move into multifocality, we got to talk a little bit more about adaptation, neuroadaptation. That presbyopia didn't happen in a day. It's not going to go away in a day or be treated in a day. And so we have to have a little more patience there. I love that. And then the future will have contact lenses that regrow my hair, make my eyes whiter.
Get rid of your wrinkles. Oh,
There
sorry, you
you
don't have
go.
any wrinkles, but if you did.
I do. Um, but yes, there's hope and there's a lot of great opportunity. And I think there's unmet need is what we're saying in a lot of the things that cross over, like dry eye and contact lenses. We're going to close up here. I'm going to ask each of you what you think the major next thing somebody could add to their current contact lens portfolio. So I'm doing contacts, I do soft lenses, I do a lot of contacts, but I haven't really delved into anything outside of I'll just in quotes say the normal or the usuals, soft spheres and this sort of thing. What do you think would be an easy thing for doctors to embrace to better care for their patients?
Well, contact lenses are like tools in our toolbox. So we have so many different options. You're saying if someone is fitting a lot of soft spheres, of course, we can move on to astigmatism correction and multifocal lenses. But we also have great lens options. So corneal gas permeable lenses are still really helpful. They're a great tool. We have hybrid lenses for regular and irregular corneas. And scleral lenses are great options for so many different indications. So, if you'd like to grow your practice, contact lenses are a great way to do so. There are so many great, wonderful resources that can help you bring, say, specialty contact lenses into your practice. And it's a wonderful way to help your patients and to help not only their vision, but also their comfort.
I agree with you. I think that being a good contact lens fitter is such a practice differentiator and really sets your practice apart and will bring you endless referrals if you can fit a complicated patient in a contact lens. And so without, you can't fit a contact lens without really looking at the ocular surface and really treating that dry eye patient. So you got two specialty clinics going right now. You got a specialty contact lens or contact lens clinic and your dry eye clinic. And being able to make a patient happy and put them back into contact lenses with success is worth any amount of money you could pay in marketing just by their word of mouth referral. So yeah, I would say open your toolbox, try out some more lenses. I think it can be, there's so many different options out there. I think I would probably say, read about them, see which one you think sounds the best, and then try it on 10 patients in a row. Try that lens and get comfortable with it, test it out. Don't have one or two negative outcomes sort of influence your wanting to fit that lens more. So be open to trying new things.
I love it. Love it. Thank you, Drs. Garlich and Dr. Barnett, for another wonderful discussion. Again, I'm Dr. Jacob Lang. Thank you for listening to this special episode of the Mod Pod. Please stay tuned for another installment coming soon.